Thank you very much, and welcome to you, and welcome to our three panelists today. I think one of the things that we've become very sharply aware of during the pandemic is inequities within the healthcare system, concerning vaccines in particular, and concerning the genders. Women in particular have been bearing such a large part of the burden during the pandemic. Each of you are experts who have your own unique perspective on how the pandemic has affected people, in particularly women. Can you perhaps share with us some of the most significant impacts that you've seen the pandemic has had on women, either in your own life or in your work? And let's start with...
So one of the things that I think we've recognized is for women of color, in particular during the pandemic, that there has been a lack of access potentially to healthcare. Perhaps differences within the healthcare system that are affecting women of color. And then among the different communities, I think what was really important was the information about vaccines and perhaps even the misinformation that was provided. And we needed to make sure that we could address all of those inequities to healthcare and try to make it better for women to be able to get access to healthcare and people of color to be able to get access to vaccines and to get the right information. And so at Women's, there was a lot of work that was done in terms of providing videos, information that was directed in multiple different languages. We have a Crossroads clinic where a clinic is specifically for immigrant families, and there were pamphlets and information sessions provided in different languages in order to make sure that women and people of color were actually given the right information about vaccines. So I think there was a lot of work in trying to address those inequities throughout the entire pandemic. Mm-hmm. But it's really opened up where we need to continue to work and where we need to continue to focus.
Yes, thank you very much. And Dr. Price, what about some of your observations?
Thank you, Pauline. One of the things Women's did very quickly at the beginning of the pandemic was open up a COVID assessment center, which was really a testing center. And we put it together very quickly, and we quickly learned about the inequities. So we often saw people who were homeless or underhoused coming from shelters and talking to us and having really nowhere to quarantine or self-isolate. So we had to quickly put together a fantastic team that looked after these individuals. They were mental health workers, social workers, and really looked at security issues for them, housing issues, and helped them out that way. The other issue that we quickly learned about were the victims of gender-based violence. So we would be calling people with their positive results and counseling them about how to look after themselves and how to keep themselves safe, and hearing horrible stories about, I'm afraid to stay at home because of the violence in my home. If I stay at home all day with my kids, none of us are going to be safe. So really meant a lot to the hospital staff to hear that what we always think of safe is the home, to hear that it wasn't, and how could we address that. So we had a lot of quick early learnings and spent a lot of time working on that from an equity point of view.
And thank you so much. Dr. Vigod, tell us about some of your particular observations about how the pandemic has affected people and women in particular.
Yeah, I think what Jennifer has mentioned about gender-based violence, I think really, I'm the head of the Department of Psychiatry at Women's, and we run, various programs that are really targeted toward the unique biological stages that affect women, like pregnancy, for example, as well as things that women are disproportionately affected by already, like, for example, trauma and violence and poverty. And so, on top of all of the, on top of fears of having the virus, were all of the issues of the containment efforts, right? And so women were really disproportionately affected by all of those caregiving responsibilities, right? Having kids at home. We know that our workforce even is, gendered towards the nurses are more likely to be women. And, the pregnant women, I don't know if people remember, but around when the pandemic first started, people were going into the hospital labor all by themselves. And so there was really, there was a lot of stress, and then all of the support systems that people have, around that kind of time were taken away, right? So usually the grandparents could come and help, or there would be programs in the community, or you could go to the library with your kids and school, and all of that was taken away. So we really saw, I think in our reproductive mental health program where we see pregnant people and postpartum people with mental health issues, we saw a doubling, tripling of our referrals because people were really, really, really struggling. And then we later looked at Ontario-wide data, and we found again about a 30% increase is in kind of need for seeing physicians about mental health around the time of pregnancy. And not surprisingly, as Rulan has brought up and as Jennifer has brought up, there were people who were sort of doubly vulnerable or doubly affected, right? If you were poor, if you were from a certain cultural group, if you're an immigrant and you maybe don't have all of your support systems, those people were even more affected. So those were the kinds of things that we saw, while at the same time we also saw our workforce affected and struggling because most of our workforce, and especially women who were trying to combat the pandemic, also had all of those stresses too. Mm-hmm. So those were really I think some of the unique things that affected women.
So we've touched on this already a little bit, but our next question will address how we've approached the inequities at Women's College that have been laid bare by this pandemic. Where do you see some of the greatest strides that have been made by the hospital in the past 2 years? And Jennifer, Dr. Price, let's start with you.
Thank you. I think one of the biggest things we realized was that we had lost a lot of access to care because a lot of our care at Women's College is actually delivered in a group format. So quickly we got into virtual as a one-on-one format, but we really had to look at how we were delivering care, and we actually had to push our electronic patient record vendor to help us enable group visits within the electronic patient record. And it's notable that we're the first hospital in North America that really pushed for that and were able to do it. And so it quickly came into being, and mental health delivers a lot of virtual care, cardiology does, our chronic pain, and headache. So we actually increased our access, and some of those groups like chronic pain actually saw an increase in their access because people were able to access virtually where they could not have come downtown to the hospital. And we did a lot of focus groups, post groups, and we heard that people would say that to us. I would never have been able to make it to the hospital for this intervention, but virtually I was able to be there and I was able to complete the group, and that's made such a huge difference in my life.
And that sounds terrific. Simone, Dr. Vigod, maybe you can pick up the thread. I know that mental health is one of the areas where virtual appointments have been hugely successful. I know some other areas it's not as easy to do that.
No, absolutely. Prior to the pandemic, we were already starting with virtual, and we were starting to do research studies and evaluations about the virtual care. And as Jennifer said, very quickly, we were able then to pivot to virtual care. And I think, it did increase access, absolutely. What it also did, what we were also able to do though, was leverage technology to be a little bit more efficient. So absolutely, it was more efficient for patients who didn't have to come all the way down and wait and, and take off half a day. But we were also able to think about using technologies that were maybe what we would call asynchronous. So some modules and then, meeting maybe with somebody to do some coaching around the modules, but we were able to see a lot more, get a lot more people through at once, which was really important, I think, with the increased volumes and need for mental health. So that was particularly exciting. I think the other thing that efficiency allowed us to do is it allowed us to do more stepped care, because like we said, virtual is excellent, but there's also what people call the digital divide, right? There are the people who either don't have the Wi-Fi or who don't have a safe and private place at home, right? And so what this allowed us to do was be able to stream people to virtual who that was good for, but also open up our ability to bring people in when they needed to be brought in. And we really started paying attention to some of the inequities in terms of who was actually getting seen in our clinics. Right? Were we starting to see more diverse communities and starting to increase access for the people who really needed us? And so I think that's been a real focus and advancement during the pandemic, is being able to leverage virtual, be a little bit more efficient, but also that means we're using our resources to open up our ability to, to see people who need more time and attention too.
Great to hear. And Rulan, Dr. Parekh, tell us about some of the advancements that you want to draw attention to during the pandemic at Women's.
I think one of the programs that was developed specifically for COVID, called COVID at Home, was a program that addressed virtual care and using the virtual space, but also took it one step further. So patients who had tested positive received a phone call at home. Then it was decided how critically ill they were, and you were able to screen patients to decide how severely ill they were, should they be referred to the hospital, and how much could we do with patients at home. And it became evident that we could actually have devices sent to the house, monitor them while they're at home, have feedback every day with nursing care, and then be able to have different physicians step in for depending on their symptoms. And I think it was an integration of healthcare across the spectrum, from testing to providing care at home with their primary healthcare teams with additional specialists, and when children started getting affected, with pediatricians. And I think that made a huge difference. And in fact, it was evaluated on a regular basis, and pivots were able to be made during every single wave of COVID to be able to adjust and finesse the program to make it better. And I think it really showed us that as part of a future learning health system where we want to really build learning into everything that we do, it showed us how you can learn quite rapidly and be able to take the information and be able to implement it then in care quite quickly.
And I think it's great that the advancements that you're talking about are addressing not just, the COVID problems, but healthcare in general. And we've got one more topic that we're going to address, and that is the gender health gap. It's been an opportunity in recent months to build a healthcare system that will address and change things that have been a problem in the past. In your opinions, what are the greatest opportunities for improvement that we have as a community to support these changes going forward? And Simone, maybe we can start with you this time.
Sure. I think that all of the pivoting and all of the innovative things that the healthcare system has had to try to do during this pandemic, I think that they should give us some courage that we really can reframe and rebuild and really rethink the way that we're delivering healthcare. So, when I think about the mental health example, we don't have to go back to doing things the traditional way. We can really think about who the people are who need our help and be able to have them get the help in the place that they want to, just in time when they need it. So we can think about things like them having the ability to get help, from in a patient-facing way, maybe without a referral. We can think about, how our primary care doctors who do most of the mental mental health care can get advice from specialists, just in time, and we can really leverage technology in order to do so. And then we can think really creatively about the way that we deliver care. So for example, we're testing in a big study a new treatment for depression during pregnancy, so that women who really feel uncomfortable about taking antidepressant medications can try something that is not invasive and doesn't involve medications. And it used to be that treatment, you had to bring them into the hospital and watch them and monitor them. Well, now guess what? We do it all through video, and we give them their at-home ability, and people are coming so much faster because there are just so many fewer barriers. And so I think if we really think about why there's a gap, why there's a gender gap, why there's an equity gap, and we really think about the pathway and the journey of the person, and we can recenter the way we rebuild the healthcare system around the journey of the person, we're going to get a lot further in meeting people's needs. And I think I really do believe optimistically that our system has the courage and the experience to know that we can do that now and be confident with it. And I think also, having the support of the community to do that is also really helpful. We've had so much more engagement from people, saying like, yes, we will give you our opinions, and to be able to really co-create with the people who are using the healthcare system. So I think that's an excellent direction to go, and I think it will result in better outcomes for everyone.
Thanks so much, Simone. And Rulan, what do you think? What are some of the issues that you'd like to look at?
So I think there are two areas, and one is specifically related to data. And I think that what we need to really think about is we didn't have information about who could use the healthcare system, who was using it, who wasn't getting care. And we need to have improved data collection, specifically of self-reported race and ethnicity, and make sure that that's part of the provincial data collection. And it's not done arbitrarily, it's not done just by an individual institution, but really thought about systematically across the board. How do we do it in the healthcare system? And the second thing, and I didn't talk about it too much before, was that there's really been the great resignation of women within medicine and within science and within other areas and other fields. And we really need to think about how can we keep women within the healthcare force? How can we keep women in science? And in particular, what I'd like to do is sort of reimagine how we measure success and not use traditional metrics. I think what the pandemic has shown us is there are other ways of measuring success, and what we need to do is really use those measures of success so that we can make sure that women stay in the healthcare field, and hope that they'll be successful and help develop programs to make them successful. And so I think that's something that we need to think about as we go forward, and I like the word courage. I think we need courage to be able to try and do things differently.
Absolutely, very important. And Jennifer, we'll give the final word to you. Your thoughts on this?
Thank you, Pauline. I like the word kindness. And one of the things we saw the most in the pandemic, that often it was kindness that made the difference. Our family practice set up a huge vaccine clinic for kids, and they put brown paper all over the walls so the kids could color while they waited and while they recovered. The kindness of our vaccine centers and also our testing centers. So if people didn't have a home to go to, we're a hospital without beds, but we actually made exceptions and kept people overnight so they could self-isolate. So I think kindness in healthcare is really important. I think it's about being kind to others. And my message to my own healthcare colleagues, but also to everybody, my patients in particular, is being kind to yourself as well. A lot of people have not been kind to themselves during the pandemic. We've seen people not get out and exercise, not eat right, use poor coping mechanisms, and just to start thinking about how do we kickstart that kindness, how are we kind to ourselves, how do we get out for a walk or a stretch every day, I think is going to be really important as we get back to society as we want to be.
That's a wonderful way to end this, with the thought of kindness to others and ourselves. Thank you so much to all of you. Dr. Simone Vigod, Dr. Jennifer Price, Dr. Rulan Parekh, thank you so much for your time and for your thoughts on these important topics.
Thank you.
Thank you,
Thank you.
Pauline.